returning to news from Karnataka now, where the first 2 cases of this variant have been detected in Bengaluru. Karnataka Chief Minister Basavaraj Bommai will be holding a meeting today to discuss the state's plans after the detection of these 2 cases. Karnataka is the first state to report the variant. Let's go across to Maya now for more. And Maya, give us more details of, what measures are being taken now.
Well, after this meeting, it is very, very possible that perhaps some more restrictions will be announced. Not yet clear on that. Karnataka has been taking the mild rise in COVID case numbers also quite seriously, with more restrictions on educational institution in terms of postponing any cultural event by at least 2 months, and further testing of students, especially students who have come in from Kerala. There are strict border checks as well. The major states of concern being Kerala and Maharashtra. But now, with the detection yesterday of 2 positive cases of Omicron, there is likely to be a little bit more concern as well. Both patients, it must be said, doing fine. One, in fact, has already left the country. The international traveller who landed and tested positive left the country on the 27th of November after getting a negative certificate from a private lab. The other one, a doctor working here, he was also discharged from hospital as it was a mild case. But the health minister did say that due to protocol, he is actually back in hospital now, along with 5 contacts, 3 primary and 2 secondary contacts of his, who also tested positive. Those 5 samples of his contacts have been sent for genomic sequencing to see if, in fact, they are also infected with the Omicron variant of COVID-19. Karnataka was, of course, the state to first report a COVID death back in 2020. So this also the first state now to actually officially confirm the presence of Omicron. The health minister saying that it's also because of Karnataka's good detection methods. The health minister will in fact be meeting the deans and other officials of government medical colleges and hospitals. There is likely to be a concerted effort to try and make sure that this variant, which, as you said, some believe to be more easily spread than other variants, that is a possibility. So they will be taking measures to try and contain this and make sure that people who are infected with this do get the treatment that they need. So far, these 2 cases have been mild, which is the good news. But the fact the reporting of Omicron in Karnataka is, of course, a matter of concern. And this high-level meeting this afternoon likely to address that issue.
All right, Maya, thanks so much for joining us there with all those developments. Well, to talk more about Omicron and what it means, and now that cases have been detected in India, we're now joined by Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospital, Dr. Ravinder Mehta, Chief of Pulmonology and Critical Care, Apollo Hospitals, Bengaluru, and Dr. Ramakant Panda, Head of the Asian Heart Institute, Mumbai. Thank you so much, doctors, for taking time out and joining us on the program this morning. Dr. Mehta, first to you, Bengaluru reporting the first 2 cases of this variant, though many suspect it's already here in other parts of the country. At the same time, what's concerning is the doctor who tested positive had no, history of travel. Also, 5 of his contacts have tested positive as well.
Yeah, so I think it just comes down to where it was going to happen, as you said. Usually science has taught us, or actually events have taught us, that if it starts in one country, it's already there in many countries. It's just that that country was proactive and did its job better than most others. So it's no big surprise. Of course, it comes down to, it came to us in Karnataka. At the same time, we have to now understand that we have to now move the next level and see. The good part is there's a worldwide attempt to give information and all the things which matter, infection, the pathogenicity of the virus, how bad it's going to be, and so on. So I think it's expected. It just needs people to get the act into shape. We shouldn't go berserk, however. The initial reactions of trying to shut states down and all were clearly not so appropriate. And now the next 2 days will tell us which way we're headed. Again, time to get your act into shape, time to get your vaccination up, time to put precautions into shape all over again.
All right, and no reason to go berserk, as you said, and Dr. Panda, your view on this, because, there's been a lot of anxiety around the world, and yes, all these travel bans have come into place. Everybody's wondering what this now means, but at the same time, we're told that so far it seems to be a mild disease. We still don't know. There's anecdotal evidence, so we're waiting for more information from WHO. What is concerning is WHO has said that reinfection is more probable with this particular variant. If you could explain that to us.
See, in a hyper-connected world, and when there is an inequitable distribution of vaccine and vaccine hesitancy, still a lot of people who are not vaccinated, which means that the virus is circulating in the population all over the world for a long time. The longer it circulates, it's going to mutate. You have to understand the same way the flu virus, mutates every year. We take a flu vaccine. So it is not the last one, trust me. It is going to be third one, then there will be more mutations will come. We should not be really panicking, because the most important step still is vaccines are still effective, maybe little lesser effective, but still effective. I strongly suggest everybody to get vaccinated. Those who are elderly and high-risk population get a booster dose. And please follow the COVID appropriate behavior. Use the mask, use physical distance, hand wash. These are basic things we do. Unfortunately, this virus is going to stay for the foreseeable future with, as I said, three major things: hyper-connected world, inequitable distribution of vaccine, and vaccine hesitancy. So because of that, it's going to circulate, it's going to mutate. Again, future mutations are going to come. Hopefully, whatever scientific evidence there and also experience with other vaccine, maybe we'll come out with additional vaccine. But the present vaccine is still effective. I will not advise anybody to panic at all.
Right.
And as reports are coming out, it's a milder variant probably.
Right. We're waiting for the final word on that. Yes, but if we talk about vaccinations, we're waiting for, many are demanding this booster dose be there for at least, healthcare workers and doctors like yourself, and for the elderly, but no final word on that yet from the government. Over 41% of India is vaccinated currently. So, Dr. Chatterjee, so we haven't reached that 60% which we'd wanted to by the end of December, and therefore perhaps they can't announce boosters just yet. But the good news is in Maharashtra, people are coming back for their second dose of the vaccines, because that is something we saw was the gap. So it's important that everybody should get that second dose of the vaccine and ensure that people they know also go in and get that second dose, isn't it?
Absolutely. That's good news that this one thing good that has been done by this Omicron is that people have become more aware of the vaccine and they're coming back for the second dose. Forget about the booster dose. Booster dose is important. There are studies going about it, whether it's helpful, whether it's not helpful, whether the additional dose is helpful or not. Yes, in all probability, in immunocompromised people, elderly people, it would be definitely required in frontline healthcare workers. But what is very, very important, and I would agree with Dr. Panda, that you should, and everybody should get vaccinated. The second dose has to be taken so that you're immunoboosted. It is absolutely mandatory that you complete the course of your vaccination. Obviously, in the days to come, in the weeks to come, we'll know more about this Omicron virus, whether it has this immune escape phenomena. There are still a lot of holes in the knowledge about this new mutant virus. So whether it is more transmissible, whether it is more severe, whether it has an immune escape phenomena, time will tell. But as of right now, we should have a COVID-appropriate behavior, which is mandatory, and go ahead with the vaccination and complete to the utmost extent.
Right. Dr. Mehta, now Karnataka has had some cases of clusters of, COVID breaking out. You had that case of a medical college in Dharwad where, they had one freshers party and suddenly there were over 300 cases of COVID. We're still waiting to know what variant that was, or, if we need to be more concerned about that. But such cases are still emerging. So really a reminder that we need to perhaps be a little more cautious as COVID is still not gone, because that it seems that everybody got lulled into some kind of, very comfortable, mentality, thinking that the worst is over.
No, absolutely right. Actually, just to think about these two cases also which have come. If you think the South African gentleman has been around for a week, our other professional also has been around for a while. So it's quite likely it's just there now. And these guys have traveled, they have, 2-3 levels of contacts. Those guys will have to be tested. It's already all over the place right now. As my good colleague said, it is a massive wake-up call. The nature of COVID precautions and COVID behavior has been, we want to shoo the disease away. So all precautions, whether it's individual, governmental, or organizational, go down over time. And the same was seen with vaccination. Besides that 100 crore benchmark, we had nothing good to talk about for a while. Now it's come down. Again, the reminder has come. These are there to stay. A, B, we will have to keep our guard up. C, we will have to have a worldwide consortium to share information. D, it's multi-centric. So don't go nuts. Take it as a worldwide phenomena. Vaccines should be spread out more. Vaccine success should be looked at. Share the data. Stay calm. Understand that you'll be in this what's called a preparation stage for a while, at least for a few months now. And that will help us to get over it with a more organized platform.
Right. And Dr. Panda, what you were saying about vaccine equity, that is something I think that's really come to the fore with the emergence of this new variant, because we do know that in many African countries, it's very low levels of vaccination so far, and the world really needs to do more. And you have all these organizations working to ensure vaccines reach various countries. And that is something that, we need the US and Europe to concentrate on as well.
Yeah, absolutely, absolutely. In addition to that also, there is a lot of vaccine hesitancy. A lot of people are not taking. So my again, I'll repeat that we don't need to panic. This virus again is going to mutate in future, is going to be there for some time. As long as the entire population, world population, not vaccinated, or they have developed the disease, they develop certain level of immunity. What the experience with other diseases is, as time goes on, the number of the waves are going to be lesser and lesser. It's not going to be like first and second wave. You don't need to panic, because there's already, as my colleague said, that 40 crore, more than 40 crore. There are 40 crore have been fully vaccinated. Another 40 crore has got one dose. Total 1.24 billion dosage has been given as of November. So we'll request everybody, please get vaccinated. That is going to give certain amount of protection. Plus, those who have already got infection, they will have some amount of protection. This is going to prevent at least the severe form of disease. I think very quickly the government and WHO will come out about booster dose, because not adequate information is there. You don't need to panic and give booster dose to everybody. But at least the high-risk population, we should cover them with the booster dose. And again, last but most important thing, please follow COVID-appropriate behavior and don't panic.
All right. So just, be careful. We have all, that COVID appropriate rules in place. We know what we need to do and basically continue to follow that and not panic in the face of this new variant. Thank you so much, doctors, for joining us on the program this morning. Thank you.